call.
Clarence Campbell.
Here.
Richard Beaver.
Here.
George Butte.
Here.
Laura Negro.
Here.
Dr. Keller. Dr. Horning.
Here.
Second. Joy Henderson.
Here.
Elizabeth Brannick. Elizabeth Brannick. Or who's not.
Public comments. Anyone?
I'm sorry to interrupt, but I don't know if it's just me, but we cannot barely hear the people in the room online.
It is not just you, Tasha.
No, it's not. I can't hardly hear either, but I can hear you guys really well when you talk.
I think we can hear you guys very good too.
Yeah, we can hear you well.
It'd be like in the meeting I was in yesterday here. We had someone on Zoom and he was yelling, "We can't hear you." Like,
Well, we can hear Erica. Lisa, can you try to say something again?
Yep, there is a plus and minus sign on the owl. Can you hear me?
That's a little bit better than what before. When you did roll call, we could barely hear you.
It's going to be the same thing.
You think the heater would be phone noise?
No.
It
I
seems
can hear
to be
you
a
pretty
little bit
good
better
now.
Yeah.
Yeah.
All right.
You can hear me okay?
We'll see what happens. Let us know if
tech problem.
you have problems.
Thank you.
Next item on the agenda is public comment. Anyone online for public comment? Don't see anyone, so we'll move on to the approval of the minutes of the last meeting.
Move to
Oh,
approve.
is there?
Is that Liz? You want it?
Yep, I'm on the phone.
Okay, Liz is
thank
there,
you.
okay.
Yay.
Right.
Okay.
Approval of the minutes of the last meeting.
Move to approve.
Motion by George, seconded by Dr. Keller. Any comments? Otherwise, all in favor signify by saying aye.
Aye.
Hi.
Opposed? Motion carries. Next item is discussion and action items, 2024 end of year expenditures. Amber,
Okay, can you guys hear me?
I hear you loud and clear.
Okay, good. I'm just gonna warn you, I'm at a softball game, so if it gets crazy loud, they got a big inning going, just scored 7 runs, so it's going good.
Put that
Just
the
in case
minutes.
you guys were wondering. Okay, so here's what I got. This isn't 100% done, but I would say 99. We did put in some entries this week, some audit entries and some things that have still coming in. Overall, like looking overall at the county, we are under budget, which is great. And you can see some of the programs went over and had some more expenses, but also had more revenue. And I don't know if you kind of noticed on CCS that it's like a negative number in the levy. That's because there was prior year revenue in there, so I know it looks funky, but it's good news. So I just did a analysis about a month ago to make sure, because it's supposed to be 100% paid program, and we were getting about 97% in those first few years. And then between some extra payments that we got in 2023 and 2024, during their WIMCR, they found the error that was causing us to not get 100% reimbursed. We don't know what the error was, but they found it because we've been 100% reimbursed for the last 5 years that I went back and checked. So that's great. For budget purposes, I'm still probably going to budget at 97, just because that's me and I like to play it safe. But we hope that after we do the WIMCR process this year, we would be reimbursed 100% for 2024. Everything runs about a year behind. So that's why you kind of see that negative. It looks a little funky. Other than that, I don't really have anything else to report on here. Does anybody have any questions for me?
Oh, when do we start getting 2025 numbers?
At the next meeting in June.
Okay, thank you.
Yep, we're still closing out year end. I mean, I could put together something, but you'd only have through February and it doesn't paint very much of a picture because revenue, like we're just receiving January revenue. So by June, we'll have a good picture of see how in June, I'll do reports through April. And then you have a kind of good idea how this first part of the year is looking.
Thank you. I just want to say that this feels weird talking to an owl. And it's not even a real one.
Well, I could put you want me to put my video on so you can see the ball field or the river behind me?
You're fine.
Okay, anyone else have any other questions?
Okay. Thanks, Amber.
Thank you, guys.
Move on to approval of the community support program plan and policies.
So as you can see, there's just a couple pages. One thing that was pointed out to us that I would just mention is there was, I think it was the client rights section that still lists Clark Schroeder instead of Dan Grady.
It's been fixed.
Oh, you did fix it?
Yeah, it's
So it's
already
fixed
been-
in here?
Yeah.
Okay.
Yeah, it's fixed in your copy and online.
Okay. So other than that, we just are redoing everything. We have a recertification coming up next week. It's always fun. So we wanted just to make sure everything was up to date. They have been doing a lot of work on this, going through every policy we had, updating it, making sure we're ready for when the state comes in and scrutinizes us, and I think we'll do great. But so anyway, that's why these are all being redone. They should be fully up to snuff and ready to go unless anybody has any questions.
Just wondering who is our psychiatry contact on this?
We have Dr. Holmgren, who is contracted. And for those of you who've been around here, he used to have a clinic in Washburn. He moved away. I believe he's in Minneapolis, but he does telehealth with us. So we have years of history working with him in the past, and he's basically retired, but he does this for us, and it's been very good.
And
It's
the
only like
follow-up question is,
six
are we
hours.
overloaded or underloaded, or how is the work, the caseload versus our capacity?
For the psychiatrist or in general?
Psychiatry.
We only use him about 6 hours a month. So.
Any other questions? I'll give you a minute to look over this whole document.
30 seconds, read that.
Do we need to make a motion to approve this then, or?
Yeah.
I'll make a motion to approve this community support program plan and policy.
Motion made by Rich, seconded by Dr. Keller to approve the CSB program plan and policies. Any further comments or questions? Otherwise, all in favor signify by saying aye.
Aye.
Anyone opposed? Motion carries. Consent agenda. This one is public health communicable disease investigations.
Did you want a
Do
brief?
we need to go through these one at a time, or
We do not.
can we approve them all?
We can approve them all. It can be wide open, so.
Anyone have any questions about any one of them? Otherwise, a motion would be in order to approve A through E in the consent agenda. Move to approve. Motion by George, is there a second?
I'll second.
Second by Laura Laura Negro. All in favor signify by saying aye.
Aye.
Anyone opposed? Motion carries. Public health updates.
All right, so for public health updates, I brought a little show and tell. Just pass that around. So this is tick collection, disease prevention using ticks for good. So it was actually put out by the Marshfield Clinic Research Institute. They had put out just a brief informational thing asking if anybody would be willing to help out or considered putting them into vending machines, which piqued their interest and they thought it was a great idea. So it's going to work out very well for distributing their tick collection kits through our public health harm reduction vending machines. And a new concept for them. So they're actually promoting our vending machines through the research project that they're presenting. So it's just a simple little kit like this and they will be free. We're going to stock them in at least 2 of the 3 vending machines that we have for now. So when somebody wants to take one of the kits, it comes with the return envelope, self-addressed and stamped in it. It has the lovely little biohazard bag in it for collecting your creepy critters. And then there's a tick identification kit inside of it, and then the instructions, and then a little survey to fill out as far as, what were you doing when you found your tick? Did you find it on yourself? Did you find it on a pet? That sort of thing. If you use tick prevention, just kind of general survey information that they're including into their study. So then they will actually analyze the tick. Once it gets back to the institute, they will identify what type of tick it is. They're doing an analysis to see if it's carrying any tick-borne illnesses. And then it's kind of a really cool little map that they have where they drop a pin where all of the ticks were located throughout the site, throughout the state, what type of tick it was, if it's carrying any tick-borne illness and everything like that. So the information doesn't actually go back to the individual that collected the tick and sent it in, but it is available for anybody to visit the website and they can kind of see like what ticks are in your area, what disease prevalence is in the area. So we thought it was a cool opportunity. And, I personally hate wood ticks, so let's just, research the little buggers. So
I mean, is there another way of doing, is there such a thing as like a tick trap that people can put out? Do they ever do something like that? Or does it have to be found on a person or on a dog or?
you can, whatever tick you find, you can collect it and send it in. They'll take up to 10 ticks per baggie, so per sample. There are different organizations that do the actual tick netting or tick dragging, where they'll go out and it's basically you take a sheet, you measure a certain distance, like it's a 10 by 10 yardage area, and then you drag the sheet through that area, and then some very lucky person gets to go through with the tweezers and pick the ticks off of the sheet, and then they analyze them and identify them and send all the data in. And so there's different opportunities for that as well. I did not volunteer to drag for ticks, but I'm more than happy to distribute the research packets.
If someone just finds one on the leg of their pants or shirt, they just put it.
Yep.
Doesn't have to fight anybody, right?
Nope, doesn't have to be written in. That's actually one of the
questions.
I was gonna say, I'll hand you my show and tell here. One of the questions on there is if it was actually bitten in or if you found it crawling or.
That sent in doesn't get no information back, it's just,
Nope.
okay.
No, but it all gets added to their website and there's information about the website and stuff right in the packet for where people can go for more information on it, so.
But that was awfully smart of you to get that to work with, and that was a great idea.
We had to adjust the packaging a little bit to see, so we were measuring the slots in the vending machine because they had different size packaging, and I'm like, okay, this one will fit if we can use that, so.
Oh, okay, that was
There's
good, yeah.
a little fine tuning on it, but it should all work out, and they started us off with 30 packets, and if we need more, they're willing to send us more throughout the summer, so. We'll see how long we can keep them stocked and go from there. So.
So,
Get your collection jars ready, so that way you
Yeah.
collect all of them first.
And
Go to the
I
vending
believe
machine.
I believe it says right on the paperwork to not smush the ticks.
Yeah.
Putting them in there,
that
so,
spring of the year is probably gone in no time.
yeah.
Can't take a match to them either.
I was gonna say, no setting them on fire.
Can't quite do that either. So, and I was gonna say, the spring of the year, that leads me into my next, for human health hazards. Springtime always means more calls and complaints regarding human health hazards, which we do the investigations for. We've actually had a recent influx of complaints for investigation. So just kind of wanted, to note, spread the word, if you will. Abandoned appliances such as refrigerators, freezers, or depending on the style of washer or dryer, are considered a human health hazard. So these appliances, depending on the style, will have an airtight seal and they are unable to be opened from the inside, which means that if it's sitting out in somebody's yard, there's kids in the yard, they're gonna play hide and go seek, you could actually get a small person trapped inside of one of these appliances with an airtight seal, which obviously is not going to end well. And so just a reminder for people, and again, please spread the word that if you are disposing of these appliances, please store them in a secured location inside your garage that is not accessible to small individuals until they are able to be properly taken to waste disposal, or if you have no other option but to store them outside, either take the doors off of them or chain and padlock them shut so they are inaccessible and people are not able to get into them. A RICE grant update. So that's our routine immunization community engagement grant. This was a competitive grant that we had applied for last fall. This grant was subject to some of the recent federal pauses in funding. Since the initial callback of funding, there has been a temporary restraining order issued. So we have received a tentative go-ahead to proceed with activities that we had planned, as far as spend down for this funding, but that was a cautionary go ahead with your activities. There was a court appointment today that they were going to review the case as far as the temporary restraining order and the injunction on it. They weren't sure if they were going to make a decision today or if there's going to be future court appointments or what they were going to do. So the funding is unstable at this point in time, and we're very tentative and proceeding very cautiously with following through on the projects that we had for it, because we don't want to start scheduling a bunch of clinics and then find out that we have no funding to support the staff time or supplies to go with the clinic. So just picking and choosing very carefully what we're proceeding with as far as that goes. And then the other main update that I had was, I don't remember who asked earlier about measles, but the measles update. So as of April 10th, there are no confirmed cases of measles in the state of Wisconsin. In the US, there have been 712 cases reported thus far this year. Of these cases, 11% have been hospitalized, predominantly children under the age of 5. There have been 3 deaths associated with the current measles outbreak that are ongoing. For Ashland County, 33% of children age 1 to 7 years old are up to date on the current MMR vaccination series. And then children ages 8 to 18 are 85% up to date on their MMR vaccination series. So knock on wood, if there would happen to be a case, we would definitely be focusing on that younger age group where not as many have received the complete vaccination series.
Only a third.
Yeah.
And too good, is it?
We've noticed a trend that the younger children have fewer immunizations. Which was part of what we were using the Rice Grant funding for, was reminder recalls and personalized mailings to families to provide information on immunization and outreach about recommended childhood immunizations, so. Kind of a bugger on that one.
And that's the population that's getting hit the most.
Yeah,
Yeah.
pretty sad.
I'm willing to take it again, so. I don't want measles. I don't want anything at my age, so.
Imagine you're tuned into the hazardous waste day on June 14th.
Yep,
You have that posted here?
I don't know if we have that one
You know.
posted here, but yeah. 'Cause I know we usually share it out on social media too.
Great.
So,
Any questions for Liz? Written materials.
They're pretty standard every month, unless somebody has questions on it.
Anything need to be highlighted?
Not this time, no.
Pretty easy peasy so far?
It's early.
It's early. I know.
Because in general, we don't know where we stand with all these cuts to the government, right?
That's right.
So we have to go very cautiously.
Yeah. I will share some good news that we just found out after our agenda. We were notified that our Spark program, which is the after-school program for FIP, the prevention program, was awarded another grant for the next 3 years.
Oh, great.
That's
We
good.
haven't received what amount of funding, but it's a very competitive grant, so we're very happy because without that funding, not sustainable, so.
Did I hear that we were rated the best maybe in the region or in the state, our program,
As far as the grant,
Spark program?
oh, I didn't hear that officially, but I agree.
In the unofficial survey.
There are no questions or comments. We'll move on to board member updates and future agenda items. Go ahead, George. We got,
I should have looked before I came, but is there an org chart for Health and Human Services on the website? Or I think I've seen one.
We
I don't know
always,
where to find it.
we always put it in our annual report.
Ah, that's it. Okay, then we do really good about initialisms and acronyms, you know,
Yeah.
we do really well. But when I sit down to review the package, I have two screens up. One for the package and one for Google. And I think that's fine. But for purposes of our public notice, which is just the agenda,
Uh-huh.
I think it could be helpful to have a footnote at the bottom. Identifying the acronyms of the, initialism that we use in that document. Because the average citizen, if I have to Google things, I have bad memory, but if I have to Google things, the average citizen won't know what they're reading, and that's supposed to be accessible to everybody in the county, at least just the agenda. So
I think we try to do that.
I think maybe we've had a list of initialisms before.
We do have them available, yes.
Yeah, we do really good. I mean, I'm not complaining, I'm just
Yeah.
sort
I
of
mean, we
making
try
a,
to, like,
it's just a thought occurred to me that when you go on the Ashland County website,
Oh.
look at meetings and you look at the agenda. And if you're the average person out there, if it's not mentioned, like, yeah, it's very good here. It's, says CSP Community Support Program, But if there are ones, it gets tedious
Right.
to spell them out all the time, or even the first time.
Mhm.
But if we don't spell it out, then maybe it's just in the footnote. Anyway, it's just a thought.
Okay.
It's not a criticism at all.
Okay.
Also, Mark. Well, look, there's another voice who's talking to the owl. Only one talking to the owl.
Any other comments by board members?
This is Elizabeth Franick. I had a question.
Go ahead, Liz.
Do we know any update about the concerning about Medicaid, any cuts coming, or do we know anything further about SNAP benefits or anything like that? Thank you.
Well, this is an Amy question.
Okay,
Oh, unless you wanted to go ahead.
go ahead, Amy.
I was gonna say, as far as we know at this point in time, there hasn't been anything definitive put out there. So for right now, everything is business as usual.
Thank
Okay,
you.
thanks. Any other comments, questions? Any other business? One of our quickest meetings on record, I think.
Yeah.
So,
Guinness Book of World Records, here we come.
Next meeting date is June 18th. Will that be our budget public hearing?
Mhm.
So that'll normally usually be at the courthouse.
Yeah.
Any other items, comments? Otherwise, motion to adjourn is in order. I was waiting for you. Motion by Dr. Keller. Is there a second?
Second.
Dr. Horney's going.
All in favor, signify by saying aye.
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 Bye. Happy Easter, everybody.
Yes.
Thank
Same to you.
Happy Easter.
Meeting is adjourned.